also raised shortage issues with the state administration on April 23rd. The Hindu reported that 2 hospitals in Uttar Pradesh's Gorakhpur struggled to maintain uninterrupted supply of oxygen. In the Durgavati hospital, where 5 patients died in 2 days, the management said it had to slow down the flow of oxygen for some patients as there was a delay in replenishing oxygen supply. Even as reports point otherwise, UP Chief Minister Yogi Adityanath said yesterday that there is no shortage of oxygen in any private or public COVID-19 hospital in Uttar Pradesh. The central government has started trains to transport oxygen to states. These trains have so far delivered some tankers of oxygen to Andhra Pradesh, Maharashtra and UP. Airlifting of oxygen to states has also been started with the help of the Indian Air Force, and the centre has ordered diverting oxygen for industrial use to medical use. Countries including Germany and Singapore are sending oxygen storage and manufacturing equipment to India. Why then are these states, hospitals and COVID patients facing such shortages in procuring the life-saving gas? Reports by Scroll and Indian Express have pointed out logistical, geographical and storage issues. According to an analysis by Scroll, India's demand for liquid medical oxygen outstrips its supply even if industrial use oxygen is diverted for medical purposes. Besides, oxygen production is unevenly distributed across the country, and the transport of oxygen from the states producing oxygen to those in need of oxygen entails several logistical challenges. A report by Scroll also identified gaps in the government's effort to ramp up local oxygen production in states despite facing an alarming first wave of the pandemic last year. St. Stephen's Hospital in Delhi was one of the hospitals facing an oxygen shortage crisis. At around 3:30 p.m. on 21st April, the Associate Medical Director of the hospital told News Laundry's Supriti David that they only had enough oxygen to last until 8 in the evening. He added that their oxygen supplier's plant had been sealed by the Haryana government. Soon after, NDTV quoted 2 other hospitals claiming that the Haryana government had also blocked tankers bringing oxygen to them. While the supply was later restored, Supriti spoke to authorities in the Haryana administration and the oxygen supplier to connect the dots. To know what happened, go to newslaundry.com and read Supriti's report titled, "Did Haryana block oxygen supply to Delhi's hospitals?" While you're there, I also urge you to read another story. In Uttar Pradesh, which according to reports is undercounting its COVID deaths, the Chief Minister has denied any shortage of oxygen in the state. The state has also put restrictions on individual purchase of oxygen cylinders at a time when breathless COVID patients struggle to find hospital beds. Akanksha Kumar and Martand Singh's report on newslaundry.com showed how the state's healthcare system is collapsing through the story of a 65-year-old journalist, Vinay Srivastava. He spent his last moments tweeting for help as his oxygen levels kept dropping. Their detailed report is titled, "Vinay Srivastava's death shows UP's healthcare system has collapsed." As the country faces a raging second wave of the pandemic, exposing a collapsing healthcare system while mass political and religious events continue, we at News Laundry are doing our best to hold power to account and bring out stories that matter. While this may not always be possible for government and private funded media houses, it is possible for us because of our subscribers who pay to power our coverage. So if you like our work, now is the time to join the movement to keep news free and independent. Go to newslaundry.com and hit that subscribe button on the top right corner today. Subscriptions start as low as 300 rupees a month. And now for an international COVID update. Globally, COVID-19 has infected more than 146 million people so far, while claiming the lives of more than 3 million. The US, India and Brazil continue to have the highest caseloads in the world. In Iraq, at least 23 people died today after a fire broke out at a hospital in Baghdad. The explosion was caused by a fault in the storage of oxygen cylinders, according to news agency AFP. The fire broke out inside a COVID ICU at the Ibn al-Khatib hospital. The flames reportedly spread out over many floors. In the United States, several states yesterday resumed the use of Johnson & Johnson's one-shot COVID vaccine after a pause of 11 days. Earlier this month, the country's Centers for Disease Control and Prevention had recommended a pause in the use of the Johnson & Johnson vaccine. This came after reports of 15 cases of a highly unusual blood clot reported in those who were given the vaccine. These 15 were out of nearly 8 million people who were given the Johnson & Johnson vaccine. All of the persons found with the clots were women, most under 50. 3 of them had died and 7 remained hospitalized. Resuming the use of the vaccine, however, US health officials said that they had decided that the shot's benefits outweighed a rare risk of a blood clot. In Spain, a man has been arrested on suspicion of assault after he allegedly infected 22 people with COVID-19, BBC reported. The man is said to have walked around in the Mallorca area with his mask down, coughing and telling his colleagues that he was going to infect them. That's all the news we have for you today. Have a great day or a good night depending on where you're listening from. See you tomorrow.
All the News Laundry podcasts are available on Stitcher, iTunes, and any other podcast platform.
Please subscribe to News Laundry. Help us keep news independent. To catch all our podcasts on news, pop culture, current affairs, and sport, visit newslaundry.com. Follow us on Facebook, Twitter, and Instagram, and subscribe to our YouTube channel.